Good evening. Dr. John Littell coming back to you this evening to discuss a very important issue with relation to COVID-19. One which I hope you're going to stick with me on tonight. It's of extreme importance not only to our country, the rest of the world, to have an open and frank discussion about the potential use of a vaccine against COVID-19 and the necessity, if there is any, of doing uniform or universal laboratory testing for COVID-19. I'm getting bombarded each day with questions from my own patients. Should I get tested to see if I was exposed to COVID-19 in December or January or February when I had a cough and a low-grade fever? So I'm going to answer that question tonight, and I'm also going to answer the question about whether you should consider yourself someone who will need the vaccine when and if it's developed. And the way we're going to answer these questions is using what I would call a Socratic method. I would like to provide the information to you about the immune system and then allow you to answer these questions tonight with some guidance from me. So folks out there say, you know, he's not an expert in the field. I would caution you when it comes to listen to anyone who's a self-proclaimed expert. In my 30 years in medicine, I've been to dozens of medical conferences with so-called experts. And I have a hard time finding experts in the field of medicine whose views have not unfortunately been tainted by, shall we say, unhealthy influences in medicine. And that is the overbearing influences of the pharmaceutical industry, the laboratory companies, perhaps some other political and economic agendas. Hence, I'm thankful that I'm an independent physician. And yes, I'm a doctor who could get into some trouble still, even as an independent physician. But frankly, I don't care, because it's more important to me to get this out to you. Secondly, I'm not anti-vax. Some people want to say, oh, he just hates vaccines. I don't. My kids all got vaccinated. And frankly, it took me a while as a physician and then as a parent, primarily to understand which vaccines made the most sense for my kids. I pretty much went party line, what I was taught to do in medical school, and over a number of years, as I've reflected in the book, The Hidden Truth, I had to change my views based on what I understood about the science of each of these diseases that I was trying to prevent my kids from getting. So rather than being anti-vax, I'd prefer you think of me as being one who values the role of parents making informed choices about themselves and their children, as I've discussed in previous videos. In other words, I'm emphasizing the principle of autonomy, the freedom of each parent, each patient to make a decision with all the available information that we physicians can provide them. And not before that, because to do anything before that would be a principle known as paternalism, where we basically as doctors treat every patient as though they're a child, we're their father. And yes, sometimes I have to do that, let's say with lifestyle choices such as cigarette smoking or alcoholism or other things, where I have to really get in the face of my patients in a kind way and say, you need to stop this. It's not good for you. Do you want to live to see your grandchildren, or do you want to be alive much longer, period? And so these are the kind of things you have to do in medicine. You have to balance this principle of paternalism, acting as the father figure or the mother figure to a patient, and the principle of autonomy, which treats everybody as able to make their own choices given enough information. Now, before I get into the meat of the matter, I want to let you all know I'm very aware of how many people have died from COVID-19. Some people think I'm trivializing this, so particularly my family up in Long Island, New York, some of them don't even want to look at these videos because they're in the midst of this still. They're all suffering as a result of the measures which have been taken up there, not able to leave their homes and etc. And I get that. I will have to say that I was very disturbed on Memorial Day weekend to see the headline in the New York Times, 100,000 dead from COVID-19, and listing 1,000 people by name, when in fact the CDC hadn't even said there were 100,000 dead from COVID-19. So it almost seems sometimes to me as though we had to get to that number. I'm afraid that wouldn't be very fair to those who actually did die from COVID-19. And the reality is that as a physician who signs death certificates for my patients, you know, I've been told by the CDC that if someone dies from pneumonia in a nursing home without even a blood test for COVID-19, but with no other proven cause, we are to put COVID-19 during this time of the pandemic as the cause of death. And that's not fair either, is it? To start attributing these deaths to COVID-19. So I would be skeptical, and yet I'm aware that many folks have died in nursing homes and in hospitals due to this disease. But please don't let that stop us from taking a step back, looking at the facts about how this disease is transmitted, what we now know about the individual risks of individual persons, and back off from this population health perspective that the CDC's shoving down our throats and saying we have a one-size-fits-all policy when it comes to social distancing and the wearing of masks and the administration of vaccines and the proof of immunization from lab testing. I would argue that all 4 of those measures need to be looked at from an individual basis. Now, many of you saw the video taking the mask off. I hope more of you will watch this video, because it's just as important to understand the vaccine, the rationale behind the use of the vaccine, and now the lab testing. All right, so let's start with a look at immunology, and I won't be too complicated here, but it's important. Everything I'm saying here can be fact-checked. All right? You have 3 ways of achieving immunity to any viral infection, any bacterial infection, any protozoal or fungal infection, and that is, number 1, and the most ideal method, is to achieve a natural resistance over time. And so populations have, in the history of mankind, achieved natural resistance, natural immunity to many, many diseases. Otherwise, we've been wiped off the planet, all right? We didn't have vaccines until the late 1700s. So what happened prior to the development of vaccines and other mechanisms for immunization? We wiped out large populations of people, frankly. I mean, people died from epidemics of diphtheria and pertussis in children, smallpox, syphilis, tuberculosis, measles in adults and children, right? But what happened, let's say in Europe over a long period of time is, for example, smallpox over centuries became something that most people were resistant to. They developed a natural immunity over time by small exposures over decades and generations. Interestingly, when the European populations came to the Americas, as I'm sure many of you are aware, the native populations exposed to smallpox or syphilis through sexual transmission or tuberculosis succumbed in large numbers. All right. What happens in those cases is that these native populations have had no exposure, 0 exposure to these pathogens, these viruses that could kill them. And that's the consequences of having 0 exposure over a quick period of time. You don't have a chance to develop a natural immunity. So let's use one example. And we'll relate it to COVID-19. I've been saying all along that the only folks who are at risk of getting COVID-19 transmitted from the host, the person who has it, to the potential victim, is if they've experienced a large volume of viral load over a long period of time. And I've been using 15 minutes, which is what Singapore, Hong Kong, and other countries have used. Okay, so think of it this way. Picture the virus as like a fleck of sand, right? And if you fleck a piece of sand at somebody quickly, their body can fight it off easily, right? You just hit your skin, it bounces off. Now think of a cannonball. If you fire a cannonball into that same person at a large velocity, it's going to rip their head off, go right through their body and kill them. And that's how you have to think of exposures to any virus. If you get a viral load the size of a cannonball, within over a 15-minute period of time, you're going to wreak havoc on the potential victim. So the cases I can think of in my own patients are nurses, for example, who've taken care of patients in the hospital who are actively ill. Doctors who were intubating and doing procedures on patients who got large doses from their respiratory tracts into their faces, into their respiratory tract. And remember, this is a respiratory droplet we're talking about here. It has to come through the process of exhaling from the patient's nose and mouth and come into our noses or mouths. Very critical to understand that, all right? This is not skin to skin. It is not, so therefore the gloves were found to be ineffective at preventing transmissions. I've said that from the beginning and I'm being proved right. It has to come through the respiratory tract. All right, that is how you develop a natural immunity, is small exposures over short periods of time. So I've been arguing in our population that we had to take the masks off, allow us to walk by each other in the stores, in schools, our kids playing on the playgrounds, and you might get microdoses, little particles of sand over short periods of time, and you'll be just fine. No one has proven me wrong on that. The next way to achieve immunity, which we're seeing in some cases happening now, is called passive immunity. These are the folks who have been exposed to a potential pathogen, meaning a virus or bacterial organism, and they have no they have no ability to fight it with their immune systems. So that would be these native populations that were first exposed to smallpox, or our own population of people, the nurses, the doctors, the victims of COVID-19, who were not able to mount an immune response. They did not have any antibodies because their immune systems had never seen this. This was actually, of course we all know, a new pathogen, a new variant of a common virus, a cold virus, a coronavirus that emerged in 2019, hence the name COVID-19. So with this new viral exposure, a cannonball exposure creates an immune response. The body's not able to handle it, so all sorts of things happen. It's called cytokine reaction. Everything comes out at one time, and these people go into shock and succumb because the body's throwing everything at it that they can rather than just a specific antibody to fight this. The antibodies can therefore be given to the patient passively so they don't have to worry. And that's what's called passive immunization. And how do we do that? We give them through the IV what's called immunoglobulins. Those are the immune proteins. A globulin is a protein structure, and in this case they're immune globulins, which are basically our antibodies. These immunoglobulins are stored up from people who are routine blood donors, which is why blood donors are so vital to the health of our nation. And then again, we have those who are donating plasma now, which is rich in antibodies if they've been exposed to COVID-19, and God bless those who are doing that. So that's passive immunity. The recipients are sick, they're trying to fight the infection, they've had no opportunity to develop any kind of immune response. And the third way is the one that I'm going to talk about now, which is the vaccination. The vaccination is basically giving a person a weakened strain of the virus that you're trying to conquer. Or you might even just give them particles, protein particles of that same virus. We do some of this with allergies. When you get allergy shots, you get little bits of what you're allergic to in your blood, and you develop an immune response over time. All right, so what a vaccine does is takes a weakened strain of that virus, you inject it into the person, and you try to create the antibodies. And at first glance, that seems like the ideal way to go about it, right? Everyone should get a vaccine against every illness. No, that's not true. All right? Vaccines are not always 100% effective, nor are they 100% safe. If we can achieve natural immunity, the first option, obviously that's ideal. We don't want it to take centuries as happened with smallpox. We want it to take a short period of time, which, by the way, has happened in this country even with COVID-19, which is my argument or my explanation to you to consider as to why we don't need a vaccine. Because so many millions of Americans are already demonstrating a healthy, adequate immune response. How do we know that? They've been tested to see what their antibodies are. They've been proven positive. These are the cases that I talked about in taking the mask off COVID-19. These are people who wondered if they might have had it. They never got deathly ill. They were never hospitalized. They have antibodies now. Hence, they've developed a healthy immune response. I would call these people healthy responders. And therefore, we know that people who have an adequate immune system, people who've been eating the right stuff, exercising, getting their vitamin D, their vitamin A, avoiding destructive lifestyle, things I've talked about in previous videos, these are the folks we know can develop a healthy immune response. Obviously, the children and the young people that we have seen already not getting sick from this disease. So we have those two options. We have the the natural approach, which is to develop a healthy immunity, and then we have this vaccine. So should we use the vaccine for anybody? Yeah, we should maybe. Maybe there are going to be folks who are high risk, who have terrible immune systems, they're immunocompromised, and there's going to be no way to improve their immune system. We don't want to keep them completely isolated. And maybe in these folks, even those small flecks of sand would be enough to stimulate a fatal reaction in their immune system, this cytokine response that I talked about. Now, here's my problem with vaccines in general since I've been in medicine. When I first started out in healthcare 30 plus years ago, we reserved most vaccines for high-risk populations. Let me give you an example. Even before I was a doctor, the vaccines against diphtheria, also known as whooping cough, diphtheria pertussis, which is whooping cough, and diphtheria, were reserved for people who were in inner cities. This is where they were spread. Over time, they became universal vaccines. All right, I can't argue with that at this point, but I can certainly argue with the fact that we took hepatitis B vaccine, which was initially developed for children who were born to mothers who were positive for hepatitis B because they'd acquired it through sex or blood, IV drug abuse or sex. This is not the majority of women out there, and yet it quickly became a policy by which we gave every infant of every mother born in America a vaccine against hepatitis B, 3 different shots, without actually getting informed consent from the parents. It's given in the hospital right after the baby's born. Why? And now we see the same thing happening. There's recommendations for hepatitis A. Again, primarily in these days, becoming a sexually transmitted infection, and yet it's fecal-oral transmission, usually from raw seafood and shellfish, and now because of sexual lifestyles, becoming a sexually transmitted disease. So ponder that. And now they're recommending giving it to children. HPV, which is a vaccine against a completely preventable sexually transmitted virus that's only spread skin to skin through sexual relations. Everybody's getting the vaccine. The flu shot was reserved for high-risk populations. Now it's everyone. Pneumonia shots in children were reserved for children who were in daycare settings, inner cities, not breastfed children who are not spending their entire days in daycares with dozens of other children and getting potential for pneumonia. So you understand my thinking here? All the vaccines that I'm mentioning were reserved for high risk, and now we give them to everyone as universal vaccinations, as though the only way to treat any disease or prevent any disease is through universal vaccination, rather than developing a healthy immune system and over time developing a normal resistance, natural immunity. So, I was going to do a lesson with you all, but the time is running short. But you can almost learn from history. George Washington knew the importance of developing immunity in his troops in the 1776 timeframe when smallpox was coming into our country with the British troops. He did an amazing job of quarantining those who were ill. He took fluid from the blisters of the smallpox, the troops that were sick with smallpox, and administered it to the healthy troops so that they were not wiped out when they were exposed to smallpox coming from the British troops, who had this normal, natural immunity that they developed in England over centuries. Most of the Americans had not had the ability to develop that immunity. So you see, George Washington understood the concept of natural immunity in the British troops. He wanted to see active immunization attempts in his troops by giving them small doses. Here's the problem. The smallpox itself, coming out of the blisters of the infected troops, was too much, and it actually killed many people. So where did we get our actual smallpox from? We got it when Edward Jenner, 10 years later, noticed that the milkmaids in England were developing a subtle form of smallpox, which was called cowpox. This is a smallpox virus going through the cows, getting weakened, coming out. When the milkmaids were milking the cows, they got a very mild case. He took those blister fluids, took the viral particles out of that, put it into folks. Very few, if any, died. Hence the term vaccine, which comes from the word vaca, for a cow in Latin or Spanish. You see, so Edward Jenner realized that we needed to do a weakened strain, not a full dose, and therefore we were able to protect people from smallpox with this weakened strain. So all those concepts come to play here, the natural immunity and then the active immunity, which is the vaccine. Which would you prefer for your child, though? I think we can get the natural immunity. So I would ask you in closing to consider not always what the CDC is telling us we have to do. Remember, the CDC is looking at population health, and I've said many times, they're not as concerned about the individual well-being of every child and every family, and if they were, they wouldn't be making these recommendations for universal vaccination without regard to the risk profiles of each and every patient, each and every person. And I could give you more, but you can read my book, and I'm not trying to sell it. I'm just saying there's only so much time. That's why I spent 15 years trying to write that book. The lab testing in closing. Okay, should we get the lab testing against COVID-19? Well, remember this much. COVID-19 is COVID-19 for a reason. It's not going to be COVID-20, COVID-21, COVID-22. COVID-19 is a coronavirus, a cold virus that, like influenza virus, is going to mutate over years. We are going to likely develop a natural resistance to it, as I explained. Hence, why bother even getting the vaccine or even the lab test? Because if you find out that you had an immunity to this virus in 2019 or even early 20, will that be applicable in 2021 or 2022? I'd argue it won't be. But what are we going to do with that information? Are we going to need to show proof of immunization to get into a sporting event or to get into, to travel from one country to the next? Or are you going to have to show proof that you've been vaccinated against a virus that popped up in the year 2019 and 2020? Now that would be ridiculous. We're not talking hepatitis B, hepatitis C here, which are viruses that are static. They don't change. We're talking about a virus that does mutate. All right? So let's not delude ourselves into thinking that getting a vaccine against the 2019 strand or strain of COVID is going to protect us in the future any more than we've seen with the many disasters associated with influenza vaccination. All right, I'm trying to give you guys food for thought. I believe we all need to be thinking, and that's why these are more than 5-minute videos. It takes me a while to prepare this. I hope you take the time to listen and then share this with your friends. If you like what I'm saying, I guess somebody told me recently, since I'm new to all this stuff, that you have to subscribe to YouTube and then click a little button that says that you want to receive notifications to get the idea that I'm going to come back to you. I don't know how many times I can do this, but I get the feeling I'm going to have to do it often. Because my biggest fear right now is, as people are glued to their television sets, especially with what's going on in our country today and over the previous couple days, that this is feeding into an agenda that is frightening to me. If we wake up in the morning and have to turn on the television to determine how to run our lives, whether we can go outside, go to a restaurant, go to church, allow our children to play with each other, then God help us as a nation. And this is 1984 all over again. I just read the book. It hasn't happened. I shouldn't say all over again. It's going to happen. So please, let's not let it happen. Exercise your basic rights. Value those freedoms that God has given us to make decisions. We all have brains. We need to start using them. I'm trying real hard to be an objective voice of reason for you. I thank you for listening to this. I implore you to share this with others. God bless you and have a wonderful night. Thank you.